think drug abuse only affects bad people. Some think if you struggle with drugs, it means you are simply weak. This may not be totally true. As a psychiatrist, I can tell you that addiction is much more complex than that. Drug abuse affects different categories of people: students, professionals, even healthcare workers. The problem of drug abuse is so enormous that the executive director within the tenure of 2010 to 2019 of UNODC said there continues to be an enormous unmet need for drug use prevention, treatment, care and support, particularly in developing countries like Nigeria. In fact, another UNODC report estimates that a total of 35.6 million people between ages 15 to 64 years suffer from drug use disorders. I'll be talking about what drug abuse is, reasons people abuse drugs, effects of drug abuse, what addiction is about, and the way out. If you are just seeing my video for the first time, I am Dr. Adeoye. I'm a medical doctor, a consultant psychiatrist, and your favorite mental health coach. On this YouTube channel, I talk about real, relatable, and realistic ways you can take care of your mental health. I talk about mental health in a non-judgmental way. You listen, I don't judge you at all, and I teach you how you can calm down so that you don't break down. Let's talk about drug abuse. When we talk about drug abuse, we mean you are using a psychoactive substance. Psychoactive substance is any substance you take that affects the functioning of your central nervous system, that is part of your brain and all that, just to make it simple. I know some people are thinking, but one of the drugs you give to patients as psychiatrists, they also go and act on the brain. Yes, you are very correct, but they do positive things on the brain. They bring healing. But this psychoactive substance, what they do on the brain is to harm the brain. So you know the difference now. There are different levels of use. There's what we call harmful use. It's a pattern of use because people argue about their use because they don't recognize the level of use. This harmful use is when you are using this psychoactive substance, but it has caused damage to your physical and mental health, or it has even resulted in behaviors that is leading to harm to the health of others. There could also be what we call experimental recreational use, where people just out of curiosity or peer pressure use drugs. Circumstantial or occasional use, where people say, I only take this when I go to parties. There's also intensified regular use. Yes, you are now very regular with the use of that psychoactive substance. And the most important one is compulsive or addictive use, and I'll really talk about this. So make sure you watch this video to the end. These are some common substances people abuse: alcohol in its various forms, Penuja, Chelsea, Striker, Pelebe, Coco Samba, cannabis, the igbo, the weed, and also the synthetic ones, which are very dangerous. Loud, both the Canadian and Nigerian loud, SK, Arizona, TM, yes, Tramadol, codeine containing syrups, shisha, cigarettes, ice, money, cocaine, and even some prescribed sedatives. Some drugs they give for sleep. You can become addicted if you use it beyond the necessary time. And people take drugs through different routes. Some sleep, some smoke. There's even what we call chasing the dragon. Some inject. But the truth is that no one sets out and plans to be addicted, and that's why you need to watch this video to the end. People start as a result of curiosity, peer pressure, to increase their confidence, maybe because they've gone through a trauma, emotional pain, academic stress, even cultural factors. That, okay, now culture will take this. It can actually become a problem. Or you see older family members using it, wanting to perform better at work. Whatever the reason you are using it, yes, use of those psychoactive substances may look beneficial initially, but I tell you, the dangers far outweighs whatever benefit you are getting from it. What happens to your brain during an addiction? Now, I know a lot of people argue, I just use the drugs, I'm not addicted. Please listen to this. you are addicted to that use of substance, that psychoactive substance, if any of the 3 of these 6 things you've been experiencing it in the past 1 year. If you have lost control over the level of use of that substance, that psychoactive substance, in terms of the onset, you can wake up very early in the morning and take it as the first thing. When you stop using it, you can't control when you should stop using it. And even when you use it, someone that used to be shy, used to be afraid of the parents, can't smoke those substances at home, now can take it boldly at home. Intense urge, number 2, to use the substance. Number 3, continue using that substance despite evidence of harm. You yourself, girl, you can see that this thing you are taking is already harming you, but you can't stop it, you still continue to use it. Withdrawal symptoms, number 4. When you attempt to stop using that thing, you begin to feel some symptoms, and some of these symptoms, they are specific for the type of substance you are taking. So the way you feel for those who use maybe codeine containing syrup may be different from alcohol, cannabis. And when you try to take the substance, those symptoms disappear. You take something similar to that substance. 5, tolerance. You started with just half a wrap, but now you can take 10 wraps. Gradually over time, you've been increasing the level of use, because the little one you are using before does not give you that same feeling again, so you have to keep increasing. And the last one, number 6, is you neglect other sources of pleasure in preference for that substance. You prefer not to eat. Once you see that substance like this, you are good to go. So if you've been experiencing any of these 3 of these 6 I listed over the past 1 year, you are already experiencing an addiction to that substance. You are addicted to it. Now, I need to really explain what addiction is to help you know the way out. Addiction is a chronic problem. Like, it's not a short-term thing, because it's not immediately you start using the drug you get addicted to it. It's a relapsing problem. You can start now, stop. If you are not careful, you feel you stop, you return to it again. And it's characterized by compulsive substance seeking and use despite harmful consequences. How do people get addicted? Yes, no one plans to become addicted. Addiction arises from complex factors, interaction between biology, environmental factors, and research has shown that the brain that is addicted to a psychoactive substance is totally different. It's different from a brain that is not addicted, just as a heart that is diseased is different from a healthy heart. Now, your brain has what we call a reward center, and that is where the addiction attacks. Our brains are wired to ensure that we repeat life-sustaining activities by associating those activities with pleasure or reward. The pleasure or reward is largely related to the dopamine the brain gets. So survival activities like eating, they produce dopamine. So imagine your brain has a reward button, normally good food, exercise, achievement, friendship, all this release dopamine, reward, pleasure to your brain. Psychoactive substances, directly or indirectly, they target this reward center in the brain. They will now flood it with higher dopamine. In fact, some of the dopamine some substances, psychoactive substances, give the brain is like 2 to 10 times higher than the usual, normal, natural good ones like food, achievement will give the brain. And their own is even faster. And so they begin to activate some things in the brain, and later the brain will just close up to the normal ones and will prefer the ones that you are getting from the psychoactive substance, because it's higher, it is immediate. And so before you know it, your brain begins to say, I want more drug than anything else. And that is why addiction is so powerful. Drug addiction rarely starts overnight. There are some signs you may notice if you are suspecting that it's like this person is already getting addicted. Sudden changes in personality. You see the person has changed. Used to be calm but now aggressive, can look at your face, talk anyhow, and then declining academic performance, secretive behavior, financial problems, because they need to fund buying of the drugs. Now, you can't conclude on one sign and say this person is using drug, or they become easily, or other, even if they are not addicted, signs that they are already using these substances, aggression, and then problems with their thoughts, dangerous behaviors, and all that. You can't conclude on a single symptom. You have to put everything together and have a compassionate conversation, and possibly with a professional. Now, what is the way out to addiction? Prevention is the most important one. Don't even start. There's a saying we have that you take a drink that is a bottle of alcohol, a bottle take one more bottle, and before you know it, the bottle takes you yourself. Can someone quit drugs by willpower alone? Sometimes, but many cannot. And the reason is what I explained earlier. What happens in the brain? Because addiction changes not just the way you feel, but motivation, reward pathways, decision making, impulse control, a lot of things in the brain. So treatment will have to include some things like detoxification, counseling, family therapy, medication might even be indicated, rehabilitation, support group. All these are things professionals will do if you take the person to a professional. Parents can help teenagers to have a more meaningful conversation. Instead of, are you taking drugs? You seem, something like this is better. You seem to be stressed lately. Is everything okay? Create an environment where children feel safe to talk openly about these things, to help other people you know who are struggling. Don't shame them, don't threaten them, don't call them names. Instead, without judgment, encourage professional help, stay supportive while maintaining healthy boundaries, celebrate their small progress, understand that relapse can happen and does not mean that the treatment has failed. The encouraging news is that addiction is treatable. With medical care, counseling, family support, and commitment, recovery is possible. You or you know someone who is struggling with drug use, don't suffer in silence. Seeking help is a sign of strength. If this video helped you to understand addiction better, please like, share, and please subscribe. You may help someone recognize the signs early or encourage them to seek treatment. And remember, recovery is possible, and no one should have to face addiction alone. With the right support, people can really get over it. Please don't forget to subscribe and don't forget to calm down so that you don't break down.